In Pennsylvania, we have over 1.6 million individuals without health insurance, and 2 people die every day because they can't get access to a doctor. So I'd actually like to turn it over now to somebody who has been living without insurance and who's been living this story to share hers, Linda Mosca.
Good morning.
Morning.
I will just say for 20 years my husband was at a job, IFS in Reading, and 3 sons took over and my husband got sick. And they said after 30 days, your insurance is canceled. So they said he needed to go on Social Security disability. That has a 5-month penalty and a 2-year Social Security. If you retire on SSD before retirement age, you have a 2-year penalty. And because he is a heart patient, he cannot get coverage that we can afford. It's a comfort you never realized you had, having insurance, and when it's gone, you're just panicked. So somebody said, did you call Palco? I was like, who? And we personally went up to the building, and as we were walking up, we just kept thinking, we never asked for a handout. It's very hard to be humble, and they treated us like we were royalty. We just kept looking around like, somebody's going to holler at us. How did we get here? But if it wasn't for Palco, my husband would absolutely not be alive. And we had lost our granddaughter and our son in 2010. So it's very hard, and I am so grateful, and I have no idea how to manage all of this, so I'm all ears to see what I can do, but just the system as it is not working with the Social Security. I don't know what SSI is, but they get automatic insurance, and that's for people who have not worked. But because you've worked your whole life, you're not eligible for that. So I found that to be, I still don't, something's not right there, and I don't know what it is. So I am just so grateful to be part of Palco. Thank you.
30 years ago this month, I had graduated from medical school and finished my training and started in private practice. And that means that for my entire medical career, the number of Americans without health insurance, except for minor vacillations, has gone in one direction only, and that's up. The number of uninsured has more than doubled since my medical career started and now stands at nearly 49 million. But tomorrow, October 1st, 2013, marks the start of a federal program that not just counts the uninsured, which is what we've been doing so far, but actually for the first time looks to actually address the problem. Now granted, this program will not solve our problem. At best, it will eventually cover only about half of the uninsured. We as a nation have not yet made the moral and political commitment to guarantee that all Americans have access to medical care. But let us not underestimate the significance of this first step. So why is insurance important? First, we now have overwhelming empirical evidence that the uninsured live sicker and die younger. The uninsured are less likely to have an accessible source of medical care, less likely to have screening and preventative care, less likely to have treatment for chronic diseases like hypertension and diabetes, and more likely to present with late stage and end stage disease, when it is less treatable and more likely to be fatal. Believe me, I and any other physician who takes care of the uninsured has many stories to tell of patients delaying care to their ill effect and even deaths. But don't take my word for it. According to the Institute of Medicine, between 20,000 and 40,000 of our fellow citizens die every year as a direct result of the lack of health insurance. That's about 100 Americans dying each and every day. That is, or ought to be, unacceptable to all Americans. Second, the lack of insurance, ironically, is expensive. Without health insurance, each of us is just one illness or one accident away from potential financial ruin. Over the 30 years of my career, bankruptcies due to medical expenses have increased 23-fold and now account for well over half of all bankruptcies. The uninsured are 4 times more likely to use emergency rooms for their care, which of course is an enormously expensive and inefficient use of our resources. In the end, lack of preventative care and routine care for chronic conditions turns out to be very expensive. The fact that 18% of our non-elderly population lacks medical coverage is one important reason why Americans end up paying twice as much for health care as other developed citizens of other developed countries. You may have heard that this program that starts tomorrow is a bit controversial. Some are doing everything they can to make sure that the program fails, but the fact remains that 1.6 million Pennsylvanians lack health insurance, and starting tomorrow, they will be eligible to purchase private medical insurance, many with the help of federal subsidies. In addition, 500,000 Pennsylvanians would be eligible for coverage under an expanded Medicaid program if Governor Corbett agrees to our participation. And currently, as you may know, he's trying to persuade the federal government to bend the rules, so it remains to be seen whether or not Pennsylvania's uninsured will benefit from the available federal money. Thank you.